excited about that. We're going to talk real briefly about your chapter covering lifespan development. Lifespan development is pretty critical to your ability to be able to take care of patients and meet them where they're at. And there is a great span from the time a person is born until they die, the changes that the body goes through. So this chapter is going to just address some of those changes and get you better prepared to make a good assessment and realize what's normal about a patient and maybe what's abnormal. Okay, if I can get my PowerPoint to go. Okay, so our first stage in our lifespan development is what we call infancy. Nothing rocket science about that. Basically, that identifies a person in the first year of life. So from the time they're born until they're 1 year old, we're going to call those patients infants. And, you know, if you've been around kids at all, you know from the time they're born, when they are so absolutely tiny and completely dependent upon us, until they're a year old, they do go through some pretty ginormous changes. And although they still look cute and they're like a baby, they go from not being able to hold their head up to running all around the room, not being able to eat by themselves to being able to feed themselves almost completely. So big changes that go on here. Physiologically, babies at birth, you know, and these are numbers that are going to vary regarding what you read, but on average, 6.5 to 7.5 pounds. Okay, by the time they're 6 months old, their weight should double, and by the time they're a year old, their weight should triple. Okay, interesting thing about babies is their head accounts for about 25% of their total body weight. So if you have ever been to a doctor, well baby check or the emergency room or whatever, you'll notice that they always measure their heads. And that's because it's a very easy way to tell if they are in the normal range and if they're growing, if they're progressing, because the head is such a big part of their body. That's a very good way to tell if they're growing. Other things about babies, and I think we're going to talk about some of these as we go on, but their airway is much different than an adult's. A child's airway starts out relatively big in their oral airway and their nasal airway. And we'll talk about these as we get into the airway section a little bit further. But as it goes down and gets close to the vocal cords, it narrows. So it's kind of cone-shaped. And that's why babies choke on things a lot. They can swallow it easily. They can get it in their mouth very easily, but it gets stuck when they suck it down in the airway, and it actually gets lodged in there pretty easily. The other thing about a child's airway, if you feel your throat, you can feel your airway in there. It's called your trachea, and it feels like kind of like a vacuum cleaner hose. There's little cartilage rings that go around your trachea to keep it from collapsing. A baby's airway does not have that. So if you hyperextend or put their head back too far, you can actually collapse that airway, much like if you take a drinking straw out of a soft drink and bend it, it will eventually just crease over and completely obstruct. You can't suck through it because it's all folded over. Same thing with the baby's airway. They cannot breathe through it if it's hyperextended. Other thing is that if reaching across it or pushing down on the front part of the throat at all can easily collapse that airway. So we do have to be careful with our babies' airways. Babies are primarily what we call obligatory nose breathers. Means they know how to breathe out of their nose. That's all they know how to do. So if their nose gets full of boogers, they can't breathe. And they get short of breath, and they try really hard to breathe through that, but they don't have the ability to switch to breathing through their nose. So a lot of times you may get called for a child that's short of breath, and you just grab a warm rag, a wet rag, or the booger sucker and clean their nasal passages out. You may fix it just by doing that. Antibodies are passed from mother to child in pregnancy. So they're born with a fairly high immune system. And they keep that for a few weeks. Now, if they're breastfeeding babies, they'll keep it a little bit longer because those antibodies continue to be passed through. And then they're going to reach a time when those antibodies take a dip, and that's when they become at risk for things like RSV and viruses like that. Okay. Their moro reflex, or that reflex that they get when they're startled, if you ever watch a baby, they fling their arms out, their fingers get great big, and they grab onto anything that they can get a hold of. Babies are born with two eccentric fears. Okay, one of them is the fear of loud noises that will scare them, and the other one is the fear of falling. Everything else that we learn to be afraid of in life is just that. It's taught to us by our environment. But those two things, loud noises and falling, will scare a baby, and they will instantly reach out. So if they do that, you know that's normal. If you get a baby that does not have that reflex, something's wrong. And generally it's that they're a little bit unresponsive or not as responsive as they should be. And so that's one thing we want to find out. The big thing that you're going to find out about kids, and as we go through this, is that they change drastically. Kids meaning we're going from birth to age 18. Some categories even take us from birth to age 21. Those are huge changes because there's nothing about an 18-year-old that resembles an infant. And all of these stages that we're going to talk about have different characteristics and different things that we call a baseline, or what we would call normal. Now, for you guys as EMTs, and for myself being a paramedic, if I can't recognize what's normal about my patient, I will never be able to recognize what's abnormal or what's wrong. So understanding the normals is huge. And I know this seems like kind of a dumb chapter, but you're going to find that you're going to use this information more than you ever thought. The other thing I would encourage you would be to get a cheat sheet or some type of flip card, or you could even print something up and have it laminated quickly, or some type of field guide that's going to give you a resource to go to if you're taking care of a 1-year-old, that you can flip to and see what is the normal respiratory rate, heart rate, blood pressure for a 1-year-old. Because I can tell you as a paramedic, I don't take care of enough kids of every age to be good at that. I'm a mom, I have 2 kids, I have 9 grandkids, I have been around kids all my life, I've babysat forever, and I still go to my resource because I don't absolutely know what the normal respiratory rate for this particular age group is, because that's not something we normally do, is see how fast this kid's breathing. Even if we're around kids all the time, that's not something we're really familiar with. So these things are normal for an infant, okay, that startling reflex. The other one is the palmar reflex. If you put something in their hand, they grab a hold of it, okay? And then particularly with younger kids, especially breastfeeding babies, they get that rooting reflex. So if you hold them up to you and hold them up to your chest and they're hungry, they're going to turn towards the side of their head that is touching your body for hunger. So the same thing follows through if you are assessing a patient. If you touch one side of their head, an infant, they should turn towards that side that you touch. Okay. Other things are sucking reflex when you touch their lips. If they're hungry especially, they should start to suck just a little bit. Sleeping patterns. If you've been a parent, know that in the beginning you don't get a whole lot of sleep. They may wake up every 2 to 3, 4 hours to be hungry throughout the night. After 3, 4 months, 2, 3 months, that should start to regulate, and they should actually start to sleep through the night. So their extremities grow through a process of the bones elongating and becoming bigger and stronger. And so when you deal with children that have possible fractures, they're going to be very concerned if those fractures happened in the growth plate. That's going to be the one you hear the most of. Because if it fractures that growth plate, that's going to inhibit that bone from being able to elongate further as the child grows, which can be a big issue. So you'll hear that. It's not really anything that we're going to be doing, and we're not going to be taking x-rays or casting or splinting those particular types of fractures after surgery. So just know that those are there, and they are a big concern if there is a fracture there. Okay. Other things with babies that we have to really think about, if you've had a chance to be around an infant, they have what they call soft spots in their head. And basically, the skull is made of several plates. And those plates actually squish together and overlap one another as the child is coming down through the birth canal under very confined spaces. And the ability for these plates to shift and move a little bit assists with that baby's head being able to deliver. When you have a newborn baby, those plates have not yet welded themselves together, okay? And you're going to have places in between that will be soft spots. And if you touch them, you don't want to push heavy on them, but if you touch them, you can feel that there is no skull under there. So we've got to be very gentle with those. They come in handy when we're looking at our child to tell if they're dehydrated or not. If those, we call those fontanelles. If the fontanelles, or those soft spots, are indented, then that child is probably dehydrated or hypovolemic, has had some blood loss. If those fontanelles are bulging out above the skull, then that child has got increased pressure in the brain, and that should be of concern to us. So oftentimes you can actually see a pulse in those fontanelles if they're bulging a little bit. So we just need to make sure that we handle those very gently. And when you're looking at a baby to assess them, take a quick look at it. It will tell you a lot. Now the posterior, the back soft spot, which is kind of on the top of the head, will close in 2 or 3 months. The front one is between 9 and 18 months. I have a 15-year-old set of twin granddaughters. One of the granddaughters, they're not identical, but one of those, both fontanelles were closed, 8 months or so, and they were born about 6 weeks early. The second one is 15 months old, and her front fontanelle still is not yet closed, not even close. It's still rather big. So, okay, and again, sunken fontanelles indicate dehydration. Bulging ones indicate that increased pressure inside the skull, which can be a result of a head injury, brain injury, or something like that. Okay, so if you know a lot about babies, you know, there's a period of time they really don't care who's holding them as long as they're being held. They don't really identify. I think they know mom because they recognize her sound from being in utero for so long, and possibly dad too, just from being around. But really, as long as you're treating them gently and they are fed and warm and dry, they're happy campers. Okay, and then as they go through their learning process for that first year, they learn to bond to certain people. They learn to trust you if you develop a trusting relationship with them, or they also learn to mistrust you if you're the type of person. My ex-husband had a very loud, booming voice, and for some reason when he talked to kids, he talked loudly, and he terrified kids. So he had a very hard time developing that bonding, that trusting bond with them, because not that he was mean to them, he wasn't, but his voice, and remember what I said, they're afraid of loud noises, so his voice scared them, and that eliminated the ability for them to ever learn to trust them. So we kind of want to watch the relationship that these kids have with their caretakers. And as you know, that we are mandatory reporters, so we've got to keep our eye out always for kids that are abused or mistreated. So scaffolding is building one upon another, taking one skill, using it to build another skill. And then our kids, in this first year of infancy, develop a temperament. We've got some kids that right off the bat are very complacent and very easygoing, and you've got other kids that simply are not. And that's just their personalities are starting to develop right from the very beginning. Okay. Next phase is the toddler phase, and this is 12 to 36 months. So this is a pretty big stage, and I'm telling you, a lot happens in this stage. Okay, so here's our 1-year-old infant. Okay, kind of learning to walk, maybe walking a little bit, but very much starting into that acquisitive curiosity stage. And so this is when kids start to climb, they start to put everything in their mouth. It gets to be exciting and a little dangerous. Okay, so they are developing more stabilized pulmonary systems, so their breathing becomes a little better, their airway becomes a little wider. They start to develop those cartilage rings around their trachea, so it becomes a little more protected. Their nervous system starts to become a little more developed, and they learn, if it's hot, they pull back. Their musculoskeletal system, their muscles and the bones are getting stronger. The muscles are getting stronger. They're learning to coordinate the muscles with the nervous system and to develop those. Initially, it's those gross motor skills. They're learning to hold stuff. They're learning to throw stuff, a lot of stuff right off their high chair. They're starting to learn to understand when they do something, like they throw something off the high chair and it bangs loudly on the floor. They start very quickly to associate that this action produces this result. Okay? Their immune system starts to stand on its own. It's not relying on mom's antibodies anymore. And depending on what they are exposed to, their immune system can develop and become much stronger. We used to take our kids out. If the neighbors had chicken pox, you ran your kids right over to get them exposed right away so they wouldn't have chicken pox when they were older and make them very sick. We've kind of replaced that theory with vaccines. And however you feel about vaccines is your own personal opinion. But vaccines are kind of coming down the way. The other thing they're starting to do is they're starting to get teeth, and a lot of teeth, and a lot of molars, and that can make kids really sick. Teeth in general kind of cause a low-grade fever, fussiness, irritability, diarrhea a lot of the times. As they start to try and pop those molars through, that becomes really an issue. And some kids can get really, really sick with those teeth. And it seems to mom and dad, because the kids are acting differently than they've ever acted, that something is really, really wrong. And we have to go with that until we can prove otherwise. Okay. So as I was talking about, they begin to understand cause and effect. About 18 months, it's been proven that kids understand consequences. So if you smack their hand, because they touched something they weren't supposed to talk to, they can understand why. They start to develop separation anxiety. Mom leaves, they cry, it's a horrible thing. And then mom comes to pick up from the babysitter, and they cry because they have to leave the babysitter. But they're starting to build relationships with people and become very anxious. Sometimes, to the point if you leave with a sitter that it's really an ordeal. And some stages will be worse than others. They do start to develop their imagination, and they start play acting, and they start learning to entertain themselves a little bit during this phase. Okay, and there's a kid. Give him a hose. He's happy for the rest of the day. Okay. Next stage is preschool age, and this is kind of when they start into preschool, obviously, so 3 to 5 years old. You can see how far we've come from that first picture of an infant. These kids are able to do a lot of things for themselves. Their body systems are continue to develop, so they're starting to develop those fine motor skills. They're learning to write. They're learning to put puzzles together, take things apart, put them back together, and use those finer motor skills that they didn't have before. They're starting to develop social skills, so they're developing friends. They're liking their friends. They're fighting with their friends. They are learning how to manipulate a little bit. They're learning how they're taking that consequence thing that they've learned and learning how to use that in a social aspect. 6 to 12 years old. Those are our school age kids. And obviously this is the elementary age kids, but look how adventurous they have become. Okay? They're starting to lose teeth, which isn't a bad thing by any means. It's a good thing. It opens up the airway, but one thing, or not the airway, but the oral airway for more adult permanent teeth to come in. One thing this does open up for is some oral decay, oral infections, so we can watch there for those. They generally need less supervision than they did when they were younger. And I say this kind of tongue-in-cheek. Sometimes these kids actually need a whole lot more supervision than they did when they were little because they have brains and they're thinking of things that they can do to get into trouble. But overall, you can leave them, like you could put them in the bathtub and trust that they aren't going to drown on their own accord. They're starting to develop decision-making skills, so you can give these kids, when you're taking care of them, you can bargain with them a little bit if they're a little bit afraid to go with you or afraid to let you take a blood pressure. You can let them try and take one on you, and then you take one on them. You can give them a choice between this and this. Both of them are things you want them to do, but as long as they think they're making a choice, gives them a little bit of ownership in that. They're much more aware of their self-esteem or lack of self-esteem. So they become kind of sassy, and they know what they like. They're also very, very peer-oriented. And so they don't want to look foolish in front of their peers. So if you go to a school or you go to a neighborhood where other peers may be there, we want to make sure that we are addressing this the best way we can so that they don't feel embarrassed in front of their friends. Okay, adolescent is 13 to 18 years old, and if you remember being back this age, it's horrific. The emotional war that goes on in their heads is tremendous. They grow rapid. There's a 2 to 3 growth spurt that happens in here, a lot more with boys than girls. But you may see kids, and they may become, this growth spurt may become painful. Sometimes it happens younger too, but oftentimes in boys, you may see these boys sprout up 5, 6, 7, 8 inches in 1 year. That brings on a whole psychological process because, these kids are kind of fit. They're not kids, but they're not adults, but they want to be adults, but they really don't know how to be an adult. They're kind of in that in-between stage. So a lot of psychological and emotional issues happen with these kids. And then you add in the sexual maturity or immaturity. Unfortunately, in today's society, a lot of these kids in this age, particularly even the younger part of this age, 13, 14, are sexually active. So although they physically can be sexually active, emotionally, probably not quite ready for that. And do they actually really understand the consequences that go along with that is something that you have to look at on an individual basis. Okay, so they are striving for independence. Again, we talked about the peer pressure that's huge, and their body image is huge, especially with today's social presence on the media, Facebook, all of that, movies, YouTube, all of that stuff. Society puts out there a body image that is acceptable or I don't know what I want to say here, or desired, I guess, a desired body image. And truly very few of us can actually achieve that. I actually read an article here a few years ago about the gentleman that invented the Barbie doll. And he invented the doll and then sold it to Mattel for production. And later on he said, had he known the impact that that Barbie doll would have had on young kids, he never would have sold the patent and he never would have manufactured the doll. Because if you look at Barbie, I think in order to have a body like Barbie, if you look at the measurements and the proportions, you'd have to be like 7'7" and weigh 103 pounds or some crazy thing. But yeah, Barbie is putting an image into our children's minds of this is what you look like when you get bigger. And when we don't look like that when we get bigger, which none of us do, we think there's something wrong with us. So, they're very concerned about that. These kids can be very prone to self-destructive behavior. And my daughter has foster kids, and we've been blessed and cursed to be able to help take care of some of these kids. It's amazing the horrible things that they do to themselves just out of a desire to deal with life. So we do have to watch for that. We do have to watch nowadays for suicidal tendencies in our adolescents, as well as eating disorders. Those are becoming very prevalent, both in males and females. So these kids, as they're moving through this adolescent stage, are developing their own personal code of ethics. And this is going to be pulled from people that are influential in their lives: parents, teachers, peers, friends, pastors, if they have a church home. And so they're kind of putting all these pieces together and trying to decide who they are and what they stand for. Now, a lot of adolescents are injured because they are risk takers. They are still at that age that they believe they are immortal. The concept of dying is not real to them. I mean, they know old people die and they get that, but the concept that they possibly themselves could die doesn't exist. So they're very okay with taking these big risks and thinking there will be no consequences. These kids really probably aren't going to be very open about telling you what happened if there's an accident that happens. But sometimes if you sit down and explain to them, I use it all the time, I am not a cop. I'm only here to help you. So if you be really honest with me, I can make sure that we get you the very best care and get you in the best situation that we can. And kind of explain to them, sometimes put it out in, if you're not honest with me, we may miss something and you or your friend could die. And if that's remotely true, that's a good tool to use because it does make them kind of think about their consequences then. Okay. Early adulthood, 19 to 40, these are people in their career years. There's people that are starting families, starting a new career, and really launching their life as an adult. Okay. Their lifelong habits are starting to form. This is when people typically reach their peak physical condition. Okay. I reached mine about 19 years old and peaked about 20. So, they're in good shape. For the most part, they're very healthy. Okay. But they do have a lot of stress. They have the stress of a new job, stress of maybe 2 or 3 jobs, trying to make ends meet. They've got a new family, babies, kids, bills, trying to buy a new home, trying to keep their car running. You've all been there, you understand, or you will soon. They're also trying to learn how to make marriages work and relationships and divorces. They're trying to learn how to raise kids. It's easy for the kids to be, we understand that kids grow up and stuff, but what we don't understand often is this is the first time these parents have been parents. So they're learning how to do this right along with the kids learning how to grow up. And accidents in this age group is the leading cause of death. So whether that's drinking and driving, whether it's texting and driving, whether it's doing things when they're too tired. And typically these people are trying to get the most out of life. So they're doing a little more adventurous things than they could as teenagers, because now they can actually sign their own consent form. And, they can bungee jump and ripcord and parasail and dive with sharks and all that good stuff. Okay. Middle adulthood is kind of that downhill side, 40 to 60 or 41 to 60 years old. They're still active. They're still, for the most part, very healthy. About this time, you start to see some vision changes in them. I know when I got to be about 42, I couldn't thread a needle all the time. Sometimes I could see it fine. Other times I couldn't. So I had to start wearing the infamous cheater glasses or old lady glasses to just help with that vision. Sometimes you start seeing people with cancer show up. Heart disease starts to develop, and weight control becomes more difficult in this time of life because your metabolism slows down, but generally your appetite does not. So it's kind of a learning curve, and what used to work to lose weight doesn't anymore. You also have parents that are, or people that are going through the empty nest syndrome. The kids are growing up and they're leaving home. So I know personally, I had 2 kids. I homeschooled them. They were with me all the time. And when they left for college, wow, what a life change. And I was excited for them to go out and be productive and successful, my house was pretty darn empty. And although I thought I was a relatively stable person, that really was a difficult thing to deal with. The other thing that they're doing is starting to care for their elderly parents who are now coming kind of towards the end stages of their life and may have medical issues, cardiac issues, cancer, those types of things, hospice care, or just can't really take care of themselves, so they've got to have some help driving, moving, cooking for themselves, paying their bills, that type of thing. So lots kind of going on in the middle adulthood, losing your kids, becoming the caretaker. And then late adulthood is 61 and older. These look very young and healthy late adults. We're not all so blessed to be like this. Our body systems start to be less efficient. Our lungs don't expand quite like they used to. Our muscles are a little weak. Our discs in our spine are starting to shrink up just a little bit. We become a little shorter. For some women, our bones become a little more brittle. Our muscles certainly become weaker. Our bodies, for the most part, kind of dehydrate. And so, our kidneys don't work like they used to. All that stuff is just kind of starting to take a downhill side. Now, if you add that with things like diabetes or muscular sclerosis or any of those things, that's only going to compound it. So we're starting to think here in the later years about our living environment. How long can we live out on the farm by ourselves? So we need to think about moving to town. What happens when we get later in life and we have to think about what can we do because we really can't take care of ourselves? We can't drive anymore, and we're starting to fall, and it's maybe not safe to stay at home by myself anymore because if I fall, I can't get up. So the thought of giving up your independence is huge, and it's terrifying for a lot of people. They start to question their self-worth. They start to become, in their minds, a burden to other people, a burden to their family, a burden to society. Generally, in this stage of life, they lose their income. So the income that they had as a working person goes away, and they now have to live on a fixed income. For some of us, that's much smaller income than others, but it's still fearful, because what if the cost of living keeps going up and I still have only this much money to spend? And then they have to start thinking about that process of death and dying. Much like our younger kids, they know it's a reality. They've watched a lot of friends and family pass away ahead of them, and they know it's coming. And for the most part, given time and patience, people prior to the end of their life kind of come to grips with that, and it's an okay thing, but it's a struggle getting there sometimes. Okay? So if I can say anything, I would say become familiar with the changes that are going to happen. Absolutely get you a cheat sheet. We'll talk a little bit about this in class, but get you something that's going to help you understand what is normal, whether it's just a set of normal vital signs or expectations of different age groups, and understand what the normal is for the patient that you're taking care of. Put that cheat sheet or that resource that you have in a place where you can look at it on the way to the call. So when you walk in the door, you know what should be normal about this patient. It's a little time consuming when you're trying to evaluate your patient and look up your resources at the same time.